Good morning. This is Dr. Bill White again with the American Orthodontic Society, and I'm going to talk with you some this morning about the temporal mandibular joint, and it's part that you cannot get away from it. So if you're doing orthodontics or whatever, just regular dentistry, or even restorative or whatever part of dentistry you're doing, you need to understand how the temporal mandibular joint works and how you can repair or help a situation that comes up where this joint is giving a lot of pain and discomfort. And I've had the pain myself. I've had different blows. Got hit snow skiing and just knocked the fool out of me. And I've had problems with it before, but then my joint is still functioning good at my age. And so that is amazing how tough this is and the things that have developed during a lifetime with the temporal mandibular joint. Now, about the last 30 years or so, I've worked with a gentleman who did nothing but TMJ work, and I did the orthodontic part and got to where I just did every bit of it. The gentleman's passed away and left his practice, and I did the orthodontic work plus the TMJ work because it's mixed up so close that you can't really separate this. And you say, well, I do orthodontics and I don't have anything to do with the temporal mandibular joint. Well, that just doesn't happen. So anyway, whatever area of dentistry you're in, that can be affected by the temporal mandibular joint and the way the temporal mandibular joint does. Now, I'll have to explain. I'm using a bunch of pictures that some gentleman from Sweden took years ago, and if you haven't gone through this video that they have, then you should try to get a hold of it and go through that. I'm going to pick certain pictures out of that and just show you some things that are going on here. Now I want to start off with, this is the condyle up here. It comes around like this. I take that back. This is a fossa coming there. Here is the head of the condyle working in here. And this is this disc. And it has attachment up here, attachment down at the lower part, and it's a little thicker over on this end. It's got an attachment coming out in here, and the mouth is closed, but this is the mouth. We're going forward in this motion right here. This is where it would go. And this is when it's squeezed up back here. You have this pocket up here. The tissue goes up in this area. And I don't know this for absolutely a fact, but this most likely is the area where the retrodiscal tissue is. Now this is a highly vascular tissue that supplies the synovial fluid, and the area of this disc right in here, when you bite down on something, this part takes a tremendous amount of pressure because the muscles that close the jaw are out here in front of it some, and you bite with these teeth, you put a lot of pressure here. So this tissue that the disc is made of in this area is dense connective tissue. It's so tough. I don't understand. You know, I'll be 94 here in a few months, and I still have the disc on my the condyle and the fossa, and it's still working pretty good in that area. Though I've been damaged there and they've healed up and everything, but this tissue has to be extremely tough, and the synovial fluid is very slick. It's hardly anything we can make to duplicate this. And now out of this vascular area, food material goes to this portion right in here. There's so much pressure on this tissue, this dense connective tissue. It's being pressed on. If you grit your teeth or press too hard, you can over time damage this in here. But just regular pressure squeezes this synovial fluid into this tissue, and that carries the nutrients and carries out the waste product from this. It goes back to this vascular area and is cleaned up, and this functions like this. There's no joint in the body that's anywhere close to as complicated as the temporal mandibular joint, or at least that's what I've been taught and everything. So this is a normal joint. You can see written down here. Now there'll be an attachment here. Now I'm going to erase that, and I'm going to advance one picture. Now we've moved the condyle way down here. It was up here, and this tissue was in this spot, and this is what I feel like has to be some of the retrodiscal tissue that produces the synovial fluid, because when this jaw closes too, this is wadded up in this area, and it puts a little pressure on it, and it may squeeze that synovial fluid into this an upper joint space and a lower joint space, and this tissue in the disc is it takes so much pressure. There's no blood vessels and no nerves in this portion of this disc. Now out here there would be, and there would be in this area right here, but this is the double concave, like it's something like, and this is where it's attached, comes back in like this, and you've got an attachment for the top part and an attachment for the bottom part down here. And I can't figure anywhere you would have the synovial fluid develop and make, except it be into this section of the thing in that area. So let's go on now to the next picture, and this is just a close-up where shows the disc fitting right in there, and this is the part that takes the pressure right in this area. Now I keep talking about pressure. Now your muscles are out in this area. They're just a little way forward of this, but your teeth are several times that distance forward. In other words, when I bite on these front teeth, if I put my finger where the muscle is just back here, and the joint's right there. So when I bite down, if I bite with 10 pounds of force right here, I write down that much, there may be 25 or 30 pounds of force spread out over these jaw joints, the two jaw joints back at the back. The jaw is just attached to your skull by ligaments and muscles, and it is functioning in that position. That's why it's really essential to wear a mouth guard if you do any type of contact sports, or it'd be well if you did it anyway. So anyway, let's erase that, and I'll go on to the next picture. And in this particular picture, let's See, this is starting out again, and that's the condyle. I'm going to just jump over that. And this is further along. Now your mouth may be completely open at this point, because this is the where your condyle is, and this is the fossa back in here, and here's where this synovial fluid, everything is kind of squeezed back into that section of from the jaw joint when you close it. Let me just go back. Now I'm going back again now, and I'm going to go to the start. And that's about where we start. And you see this area right up here. You see how that tissue is squeezed in that area. And as you bite down just gently, or just normal, I feel that synovial fluid is squeezed out, but I can't find any definite facts, different from that. It's squeezed into the upper joint space, which is here, and then the lower joint space. So it may be squeezed out of here into this part, and up in here into this portion right here. Anyway, it gets lubricated pretty darn good for this to last a lifetime in there. So we'll go ahead now. Let's get some other pictures. This is with the mouth open. This is a condyle, and the mouth, you go out, the teeth are way on out here. This is your fossa right in this area, right there. Now let's see, and that's another joint, just picture with it go just a little further forward. And now this one is going back in the other direction. Well, I'll take it back. I'm going to go to the next. This is a normal joint with the mouth open. The condyle goes out in this area here, and the ligament across here is stretched, and you've got a ligament at the inferior one is kind of wadded up down here, and you can have synovial fluid developed in this tissue in the back, which actually feeds this joint right here. And that's where if you tie the bottom jaw to the top jaw and have this pressure on there and leave it for a couple of 3 or 4 weeks like that, this tissue right in here will just die. And that real tough material, you can just scrape it off like cheese. And I've talked to old surgeons who, back when we tied the jaws up, where there was no movement in between, then you couldn't get anything to go in that, to feed that tissue, and there's no nerves or no anything in this area. And that tissue can die and you won't even feel it. But I've talked to people that say it's like cheese. You can just rake it off in there, and it's just like a soft cheese. Okay, now that's forward again. Now we're going back up. Now you can see the pressure that this fossa, the point of the fossa, and then the condyle presses, and this is where there is no food material, so you have to carry it in from here or up above to develop this, so this stays alive, so that tissue stays with you. And that's sliding to the side again. Now here we're coming back to the back again. Okay, Now this is just a plain shot with the head of the condyle just right underneath, and you can see this pad that takes the pressure. It's kind of a different color. There's no nerves and no blood vessels in that portion of the disc. And this is the thicker part, and here's the thicker part out here. And that's where this flattens off when it clicks. If this slides out of here, this will just get flat in this area. If you can hold it over in that position for a month or so, it will reshape this double concave, and that in itself helps keep the disc over the condyle as you move forward in here, because the condyle shapes, and when you get all the way out there, excuse me, I'll get rid of the phone. When you get all the way out there, you got pressure right in that area. Let me go on now, and I'm going to skip that, and here we're wider. In other words, the condyle is out now in front of the fossa, and now we'll start back in the other direction, and you can see it kind of move. Now it gets back, and it's poking that retrodiscal tissue up into that pocket where it goes. And that, I'm going to stop here at this point, and we're going to cover some other things about the temporal mandibular joint, but you need to know a lot about it, and we'll try to discuss every aspect that I can think about on the TMJ and what it does, and it'll stay with you, but you have to take care of it yourself.